Níomhar madan agus 100,000 fáilte roimh go léir, go háirithe ar ní cainteoirí uilig go dtí an ócáid speisialta seo. Richard O'Leary is my name, and I'm the Director of the National Cancer Control Programme in Ireland. Welcome everyone, and thank you for joining us for the Irish launch of the European Cancer Organisation's campaign, Time to Act, Don't Let COVID-19 Stop You from Tackling Cancer. Nálaigh the COVID-19 go bacha churart dulling lech le hailse. Today's event brings a leading group of experts, including policymakers, clinicians, and patient advocates together to discuss the impact of COVID-19 on cancer. I would like to thank the European Cancer Organisation for organising today's event, as well as my co-host, Mark Lawler, and all of the speakers for their time and engagement on this important topic. Today's session will include some recorded contributions as well as live presentations, a panel discussion, and questions and answer sessions. Without any further ado, I will hand over to Professor Mark Lawler, who is the co-chair of the Special Network on the Impact of COVID-19 on Cancer with the European Cancer Organisation. Mark.
Richard, thank you very much and welcome everybody. I'm delighted to say there are 212 registrants for this session. That's the largest we've had by far of the 12 different launches that we've had nationally throughout Europe. So well done, Ireland. But just to really want this to be an interactive session, so we want to very much hear from you. So if you join the interactive discussion in the chat box, and we will endeavour to answer as many of your questions as we can. I just want to set the scene just a little bit about the European Cancer Organisation. For those of you who are not familiar, we're a multi-professional organisation representing cancer aspirations and cancer requirements right across Europe, 40 different member societies and 20 patient advocate groups, and really working together to build consensus and to achieve improvement in cancer care for European cancer patients. And for me, COVID-19 was personal. I lost my uncle to COVID-related illness on the 29th of March 2020. And one of my colleagues, Edward Vidoliak, who's an oncologist in Croatia, while reaching out to me to sympathize with me on my loss, posed this statement. He said, people are starting to fear a COVID-19 diagnosis more than a cancer diagnosis. I was really struck by this statement because it was really worrying. But was there any evidence out there? At the time, there wasn't really. And so what we did was, working together with colleagues in University College London, we really developed a data-driven approach to see what was the impact of COVID-19 on cancer patients and cancer services. Unfortunately, what we found was really worrying. We found that for diagnosis of cancer, so looking at the early warning system for suspicion of cancer, 7 out of 10 people were suspicion of cancer, were not getting referred to cancer specialist services. Similarly, for treatment chemotherapy, 4 out of 10 cancer patients were not getting access to their chemotherapy. This was the first evidence of this in the United Kingdom, and showing the disastrous impact that COVID-19 was having. And we can see here, in relation to looking at cancer services, here focusing on endoscopy procedures, we see a 90% drop, again, very worrying. We really looked across the cancer pathway, and unfortunately we saw a presentation, a diagnosis, a treatment, also impact on clinical trials and research. We then looked to see, we're doing very well in relation to cancer advances over the last 2 decades. We've seen significant improvements, and you'll hear from Deirdre in relation to the improvements in Ireland, but the impact of COVID may set us back in some cases over a decade in relation to anticipated 5-year survival. So it's really worrying, and that's where the Time to Act campaign has come from, to address this. We presented our data to the European Cancer Organisation. They immediately set up a special network, which I'm privileged to co-chair with Miriam Krul, my colleague who's a pharmacist in the Netherlands, at the forefront of the COVID vaccine approach. And this allowed us then to look at ways in which we could convene very rapidly stakeholders from right across Europe to work together to develop a 7-point plan and to address the impact of COVID-19 on cancer, and really to mitigate that impact. And this 7-point plan allows us to build back both better and also smarter in relation to our fight against COVID. At the top of that list, very much the cancer backlog. How do we address it? But also, how do we restore confidence of European citizens? How do we look at ways in which we can use innovative technologies? How do we embed data collection as we'd use to actually identify the challenge that we were seeing in relation to COVID and cancer? And how do we really work together more closely at European level? Cancer must not become the forgotten sea in the fight against COVID-19. So what about Ireland? We need data intelligence for the impact of COVID on cancer services and cancer patients in Ireland. The Faculty of Pathology convened a group which included the National Cancer Control Programme that Richard leads, the National Cancer Registry Ireland and other stakeholders. And you'll hear from both Deirdre and Louise in relation to this work, bringing together data from different sources, which wasn't easy to do, but working together, we really showed that this was possible, and 2 reports have been published that shows the impact of COVID-19 on cancer in Ireland.
Many thanks, Mark, for that informative presentation. I'm now delighted and honoured to introduce a video message from Stella Kyriakidou, who is the EU Commissioner for Health and Food Safety.
Cancer takes time away from us, our family and friends. It doesn't care who or where we are. And it will not wait for the COVID-19 pandemic to be over. But together, we can act to make a difference. For each of us, that starts with prevention and early diagnosis. They offer the best chance of keeping cancer at bay. So please, don't wait either. Don't waste time. Time is your friend. If you act quickly enough to detect and prevent. Visit your doctor if you're worried you may have cancer. Go for your checkup. Do your screening early. Follow treatment if you're asked to. Your health services will do all they can to keep you safe. Meanwhile, at the EU, we insist that it is time to act, and we're doing all we can to reverse the cancer trend in Europe. We have put a Beating Cancer plan in place that focuses on patient needs, from prevention to survivorship. It is a plan for all Europeans. We can all make it a success and call time on cancer. It's time to act, for all of us, to act together. To find out how, go to timetoactcancer.com. Thank you.
Thank you very much, Commissioners Kyriakides, for your constant support of the European Cancer Organisation, and particularly in relation to this campaign. It now gives me great pleasure to introduce the Minister for Health for Ireland, Stephen Donnelly, to say a few words in relation to this campaign.
I'm delighted to be able to join you today on World Cancer Day for the Irish launch of the European Cancer Organisation's Time to Act campaign. I'd like to acknowledge the work of the European Cancer Organisation right throughout the COVID-19 pandemic to keep cancer centre stage and to encourage patients not to delay actions on any cancer concerns that they may have. From the outset of the pandemic, Ireland's National Action Plan on COVID-19 identified the continued provision of cancer care as a priority. Cancer services have continued to operate right through the pandemic, while adapting to the need for appropriate physical distancing and infection prevention and control measures. The Time to Act campaign highlights the importance of action by all of us if we encounter any warning signs that might indicate a possible cancer. The initiative also stresses the importance of not delaying any screening or any treatment procedures. As happens across Europe, cancer services in Ireland were significantly impacted by the first wave of COVID-19 from around March to June of 2020. There was a substantial drop in the number of patients presenting to their GPs with cancer symptoms at that time. However, encouraged by really strong communications on the continuity of services, referral figures from GPs to cancer treatment services began to recover, and this recovery gained momentum over the following months. Data on cancer diagnosis and treatment shows that there has been increased resilience in the health service during subsequent waves. Also, over time, the confidence of Irish people that they would be diagnosed and treated in a safe and effective manner has grown. This is underlined by the fact that the number of patients referred by their GP to rapid access breast, lung and prostate clinics in 2021 was 130% of the corresponding figure for 2019. During this time, I've provided significant extra funding for cancer services in Ireland. An extra €57 million was allocated for cancer services in 2021 and a further 40 million secured for this year. This is being used to address the disruption caused by COVID-19 and also to develop quality cancer prevention, diagnosis, treatment and aftercare services in line with the National Cancer Strategy. The continuation of cancer services is testament to the great commitment shown by our dedicated and hard-working healthcare staff right throughout this pandemic. They've continued, often in the most challenging of environments, to give expert, compassionate care to our loved ones with cancer. I'd like to take this opportunity to acknowledge the focus being put on cancer at EU level through Europe's Beating Cancer Plan. Ireland very much supports this initiative, which aligns well with our National Cancer Strategy, and my officials will continue to engage to advance the various flagships of this plan. I wish to thank you, the European Cancer Organisation, for highlighting the important issue of cancer through your Time to Act campaign. It continues to be hugely important that we spread the message that cancer diagnostic and treatment services are open and that people should follow up any cancer concerns with their GP, who will arrange appropriate follow-up care. As we emerge from COVID and resume more normal life, we can build on the resilience we've gained and share our knowledge on adapting to the needs of cancer patients. Working together, we can really have an impact on preventing cancer and on improving the lives of those living with and beyond their cancer diagnosis. To all of you who work in cancer services right across the spectrum of healthcare, I want to add my sincere thanks for everything you've done over the last 2 years. It's been a brutal time for everyone working in healthcare. It's been a brutal time for patients. It's been a brutal time for the people you treat, for their families. I know a lot of the work that has been done at sacrifice to you. These have not been easy times, but day after day after day, you've come to work and you have been professional and compassionate and expert in what you've done. And I just want to say thank you for all of that.
Many thanks to Minister Donnelly there for sharing his thoughts with us today. I would also personally like to thank Minister Donnelly for the significant support he has provided to cancer services in the last 2 years. And now it gives me great pleasure to introduce Frances Fitzgerald, who is a member of the European Parliament. Frances has always been a strong advocate for cancer care, including as Vice Chair of Europa Donna, the European Breast Cancer Campaign. Frances, you're very welcome, and many thanks for joining us today.
Thank you, and good morning, everyone. Thank you, Richard, for that introduction, and thank you for inviting me to be part of this very timely presentation and conference today. So important we get this information out to the general public, to policymakers right across Europe, because it's a European issue. I'm chair of a Transforming Breast Cancer Together initiative, and I'm coordinator for the Women's Rights Committee in Parliament. And we're very concerned about the kind of data being presented here today, this silent killer, this shadow pandemic, you could say. And we've seen over the past 2 years, cancer screening paused as services were directed to immediate frontline COVID-19 response. And we saw that people were very frightened about coming forward when they experienced symptoms and of cancer, for fear that they might catch COVID. And even in the UK, we heard people saying, stay home, protect the NHS. And of course they did, to their detriment. And of course, we know that you may not die from COVID-19, but if cancer is left untreated, you're not likely to survive. So critical messages that the European Cancer Organization is very keen to get out there to everybody. And I think I did a report as well on the impact of COVID-19 from a gender perspective. And we tried to get across in that report in the European Parliament as well that non-COVID related healthcare, such as cancer care, had to be accessible throughout the pandemic and similar emergency situations. We have to learn, governments have to learn from what happened in the last 2 years, with 100 million screening tests not performed in Europe, 1 million cases undiagnosed, and 1 in 5 cancer patients did not receive the surgical or chemotherapy treatment they needed on time. So we need a colossal, structured and deliberate effort by governments, and already, of course, by an exhausted, heroic healthcare workers to overcome such a monumental challenge. We really have to get the message out, go for your screening. And we have to learn as well, I think, in our member states, that, you know, we cannot put off these issues, even if we are dealing with a winter flu or we're dealing with COVID. So a final word to government, don't make the same mistakes twice. We have a huge backlog of cases to not only diagnose and treat, but even to discover. 1 million cases is a colossal number. It's time to get to work to catch as many as we can and make those systematic changes to ensure that this never happens again. Let me just conclude by saying the European Parliament is hugely motivated to work on health issues, more than it has ever been. And I think there is huge potential to work across our member states to get these key messages out there. People were frightened, but we now have to make sure they take the action necessary to save their lives and get the kind of help that's needed. And we need the policies in place to ensure that that can happen in the next few weeks and months. Thank you so much for the invitation.
Thank you very much, Frances, for your passionate commitment to the Time to Act campaign and on all the work that you do at European level, and also your support for the European Cancer Organization. It's very much appreciated. And what I'd now like to do is share with you a short video which really shows some of the support for this campaign right across Europe.
We can all make it a success and call time on cancer. It's time to act, for all of us, to act together.
Nie możemy pozwolić na to, żeby COVID-19 zatrzymał walkę z rakiem.
Dobbiamo ancora lavorare tutti insieme, perché solo a livello globale, solo con una grande iniziativa internazionale, potremo vincere questa sfida così complessa e così importante.
It's time to act. No dejes que la COVID te impida hacer frente al cáncer, y es lo que hemos hecho. No hemos dejado de actuar, incluso en los peores momentos de la pandemia.
Realitate e time to act, nu numai pentru pacienți, pentru toată lumea, pentru profesioniști, pentru policymakers, pentru politicieni până la urma urmei, dar cel mai important lucru, împreună.
The time to act is now. So not only do we need to prepare ourselves better for the future, but we need to prepare ourselves and to act better within this pandemic now.
La crise du Covid ne doit pas nous empêcher de continuer à lutter contre le cancer dans toutes ses dimensions, et en particulier dans la dimension européenne.
Unatoč COVID-19 krizi, odlučni smo u namjeri da pobjedimo rak, te riječi strateškog okvira pretočimo iz dokumenata u realizaciju.
Οφείλω πραγματικά να συγχαρώ και να ευχαριστήσω τον Ευρωπαϊκό Οργανισμό Καρκίνου για την εκστρατεία που αφορά τον καρκίνο. Έχουμε όλοι καθήκον, τόσο σε θεσμικό όσο και σε ακαδημαϊκό επίπεδο, να δράσουμε αποτελεσματικά ενάντια στον καρκίνο. Σας ευχαριστώ.
Zato je čas, da ukrepamo zdaj. Najlepša hvala in ostanite zdravi.
É com enorme prazer que me associo em representação de Sua Excelência a Senhora Ministra da Saúde de Portugal a esta iniciativa tão importante para a sensibilização de todos os governos na União Europeia para a retoma dos serviços de prevenção, diagnóstico e tratamento do cancro que foram afetados durante a pandemia Covid-19.
I really love that video. Just really, showing the support at European level, and it's really important, particularly today on World Cancer Day, that we show that commitment at European level with the Time to Act campaign. It now gives me great pleasure to introduce the Deputy Director of DG Sante of the European Commission and a fellow Irishman, John F. Ryan.
As an Irishman, I'm pleased to be with you today at the launch of the Time to Act campaign in Ireland. It's an initiative that helps to remind us that cancer prevention and care should remain a top priority. To this, I wholeheartedly give my support. Research shows that there are some alarming figures on the impact of COVID-19 on cancer services and cancer patients all across Europe. It's led to a situation where member states, including Ireland, are facing serious problems with sustainability in their health systems and also in their social care provision. Health professionals and carers, medical workers and patients are facing a considerable number of challenges such as insufficient human resources, mental health and well-being issues, training needs for specific skills, and the whole organizational problem that's arisen as a result of the focus on COVID. We also have the pressure on limited budgetary resources, which of course is also complicating things. And COVID has added a level of worry and stress, I would say, for cancer patients, carers and their families. I'm pleased to say that the European Commission has mobilized quite substantial resources to support member states and stakeholders through an ambitious cancer plan and substantial financial support. The cancer plan, the European Cancer Plan, has incorporated the lessons learned from the pandemic and addresses the impact of COVID-19 on cancer. In this, it's vital that we continue to ensure equal and easy access to preventative measures, to early detection, to treatment and to care. Each citizen across Europe deserves the same quality and standard of care, same access to new medicines, and the same innovative treatments. Tackling inequalities across Europe and within member states is a key feature of the cancer plan. I'm pleased to note that 2 days ago, President von der Leyen of the Commission launched an EU Cancer Inequalities Registry. We hope that this will help to identify the national and regional challenges we have in terms of inequalities and to identify specific areas of action to guide our interventions, guide our financial investments. This way, the European Union can deliver real change and support member states, health professionals and cancer patients, focusing on those countries and those regions and those cancers where the need is greatest. However, in this, we depend on the feedback from and the involvement of cancer stakeholders and patients in order to make sure that we have the right information and the right data on which to make our decisions. And I know that I can count on the contribution and support of Irish patient advocates, healthcare professionals and policymakers in order to help with the implementation of the Beating Cancer Plan, which is really something that's at the service of citizens, not only patients, but also preventing future cancers in future generations. And I ask you to join me today on World Cancer Day and add your voice to the campaign Don't let COVID-19 stop you from tackling cancer. Thank you again.
Thank you very much, John, for your continued support. Really means a lot to us, particularly here on World Cancer Day. Now it gives me great pleasure to hand over to my colleague and co-host of this event, Professor Richard O'Leary, who's the Director of the National Cancer Control Programme here in Ireland. Richard, you're on mute. Richard, you're on mute.
Apologies for that. You think I'd know it at this stage of the pandemic. Thanks very much, Mark. I'm delighted to speak to you today on behalf of the National Cancer Control Programme in Ireland, and most especially on World Cancer Day. COVID-19, as you've heard, has had a significant impact on cancer care in Ireland. The past 2 years have been and continue to be extremely challenging for everyone, most of all for people living with cancer and for those who have had symptoms worrisome for cancer. The impact of COVID-19 on cancer in Ireland has been similar to that seen in other countries, with a reduction in cancer service activity across all domains, particularly during the early phase of the pandemic. Since then, there has been a significant recovery in services due to our knowledge of SARS-CoV-2 infection and the increasing resilience of our cancer services in the face of COVID. We have worked with other colleagues, as Mark has noted, and published a data-driven account of the consequences of the pandemic in 2020, which is publicly available. From this work, we estimate a 10 to 14% reduction in cancer diagnosis in Ireland during 2020. Research models of the long-term impact of the pandemic on cancer outcomes have been published, but definitive outcomes in Ireland remain unknown, and we await evolving data from the National Cancer Registry in this regard. During the pandemic, the Irish Health Service faced an additional, wholly unexpected challenge due to a major cyber attack in May 2021. This unfortunately had a particularly devastating effect on diagnostic and radiation oncology services for cancer patients in Ireland. Despite all these challenges, and with significant financial support from the Irish government, as noted by Minister Donnelly, the NCCP is working to fully implement the National Cancer Strategy for Ireland, which addresses all elements of the cancer pathway, from prevention through diagnosis, treatment, and quality of life for those living with and after cancer. NCCP continues to work with healthcare colleagues at the front line of cancer care, who have worked heroically and selflessly throughout the pandemic, often at significant cost to themselves, in order to address the compounding impact of both the cyber attack and the pandemic. The pandemic is not over, and we are aware of the continuing concerns of vulnerable patients and their families in this regard, particularly as COVID restrictions ease. We now have an opportunity to optimize the provision of cancer services using innovations accelerated or developed during the pandemic. The NCCP recognizes the importance of accurate, integrated and timely cancer intelligence as an essential factor in the future provision and planning of our cancer services. The key message to people in Ireland is that all cancer services are open to provide the care they need, despite the ongoing pandemic and its consequences. The Time to Act message highlights the importance for everyone of acting on potential cancer symptoms and attending screening services when invited. I'd like to thank the European Cancer Organisation for their continuing focus on cancer care throughout Europe, which we in the National Cancer Control Programme in Ireland strongly support. Míle buíochas.
Thank you very much, Richard, and thank you very much for setting the scene in terms of the Irish context of the Time to Act campaign. Now it gives me great pleasure to introduce Anne-Marie Bird, who's the President of the European Lung Cancer Europe. She's also a researcher and, most importantly, a patient advocate. Anne-Marie.
As you have heard and will continue to hear during this meeting, the indirect impacts of the COVID-19 pandemic on the delivery of quality cancer care has been substantial, and these impacts are likely to remain for some time. While the numbers really do speak for themselves, we need to remember that behind every number is an individual, a loved one, whose life may have been cut short due to difficulties in accessing care over the past 2 years. This is not just about those living with cancer, it is also about those at risk of this disease. Many could not access primary or hospital care. Many faced significant delays in accessing diagnostics and treatment. And of course, it is also understandable that during this time, many people have been too frightened to engage with healthcare services for fear of contracting the virus. Some of the communication strategies employed during this time have left people confused as to what was or wasn't open, how they could access open services, and to be honest, many felt that their concerns weren't important as the messaging consistently prioritised COVID-19 above all else. A recent report from the Oireachtas Health Committee and the Cancer Care in Ireland in 2020, the impact of the COVID-19 pandemic, has shown the widespread disruption of cancer services here in Ireland in terms of diagnostics, treatment and screening. Like other countries, Ireland has witnessed reduced referrals for services with falls in levels of medical, radiation and surgical oncology and a drop in elective cancer admissions, all below pre-pandemic levels. At the end of the day, these issues are impacting outcomes and quality of life for people faced with a cancer diagnosis. Many of these people have already felt alone and isolated during the pandemic, and this all combined has had a significant knock-on effect on their well-being. It is also really important to understand that during the past 2 years, many people may have experienced changes in their health, be it a persistent cough or a pain or an ache, but they may now have normalized these symptoms as their new normal and may not believe that it is worth getting these symptoms checked out. There is an urgent need for education and awareness campaigns to increase the awareness of different symptoms of various cancers. Moving forward, decision makers need to put person-centered policies in place that ensure as people return to healthcare services that they will progress through the diagnostic and treatment pathways without any further delays. Now is the time to act, the time to provide clear communication that irrespective of your COVID-19 status, that you and your health are important. The buzzwords of Build Back Better need to reflect the real world lived experience and actually mean building back a healthcare service where everyone is treated on an equal footing, irrespective of their cancer or any condition they may have. People at risk of cancer and people living with this disease do not have the luxury of time. The time to act is now. The time is now to deliver a resilient and dynamic, person-centered, quality cancer care for all.
Many thanks to Anne-Marie for that insightful and thoughtful message. I'm now pleased to introduce to you Dr. Deirdre Murray, who is Director of the National Cancer Registry in Ireland. Deirdre is a public health doctor and Professor of Cancer Epidemiology in the School of Public Health at University College Cork. And Deirdre established and led the Cancer Intelligence Function in the National Cancer Control Programme for many years prior to her taking up the role of the Director of the NCRI. So Deirdre, you're most welcome and thanks for joining us today.
Thanks, Rashard. And thank you to the European Cancer Organisation for the opportunity to share some insights into the impact observed so far of COVID-19 on cancer in Ireland from the National Cancer Registry's perspective on this World Cancer Day. So going back to the pre-COVID era, at that stage, we were registering an average of almost over 44,000 patients with tumours every year, and 24,000 of these had potentially life-changing diagnoses of invasive cancer. Case counts of cancer were increasing year on year by 2.5% since 2010, but the incidence rate, which is a better impact of cancer control measures, had flattened out, and it had been, flat there from 2010. And looking at the rates of deaths from cancer, these had been falling year on year since the registry has been established back in 1994. In addition, we had observed some very significant improvements in cancer survival, and the average survival for all cancers at 5 years now is 65%. And then along came COVID-19, and the world changed. So we approached the estimation of the impact of COVID-19 on the incidence of cancer in two ways. Firstly, we looked at those cancers that were notified to the registry from the pathology laboratories, and we focused really on the invasive cancers. And as you can see, there was a significant fall in April 2020 of 52% of registrations of those cancers. There was good recovery over the following months, but at year end, there was still a 10.3% deficit in 2020 compared to 2019, and in fact a 12.9% deficit if you factored in the expected growth we should have seen in 2019. We then looked at all registrations that were on our database in September 2021. So this was both the clinical cases and the pathologically diagnosed cases, and compared that to what we would have projected based on our previous trends. And this method showed a shortfall of 14% when the actual registrations were compared to previous registrations, and 12% if we looked at it compared to 2019 cases alone. Some of these deficits we know are due to incomplete registration, because it does take some time to get everybody registered on our database. And obviously not all cancer sites appear to be impacted by the pandemic back in 2020, in that the number of patients diagnosed with thyroid, esophageal and brain cancers appeared to be within expected limits. However, the big four, as we know, breast, lung, colorectal and prostate cancers have all been impacted, with bowel and prostate cancers somewhat more than breast and lung cancers. So in conclusion, we've seen some significant progress in cancer control up to the end of 2019 until the pandemic hit, and we have clear signals that as expected, the number of cases in 2020 are lower than previous years. I suppose the unknowns and questions that remain are, what are the exact estimate? We know it's somewhere between 10 and 14, but we don't know where it is on that line. The duration of the reduction, so were there impacts of the waves we saw in 2021 on the number of diagnoses, and most importantly, what has been the impact on patient stage and outcomes? And of course, this will be the focus of the Cancer Registry's attention now and in years to come with our colleagues. Thank you very much.
Thank you very much, Deirdre, and thank you really for sharing that data. I think it's really important to see the Irish data from the National Cancer Registry, and we'll also hear from Louise slightly later in relation to the Faculty of Pathology study, but having that data intelligence is critically important. I'd now like to share with you a short video, which just infographic, which shows some of the outputs in relation to the Time to Act campaign. What I'd like to do now is just share with you some of the aspects of the Time to Act campaign, and also something new that we've developed called the Data Navigator. Again, just to remind you, opportunities, we really want to hear from you, so opportunities to put questions into the chat, which we'll pose to the panel. And following the launch of the 7-point plan that I talked about earlier, many of our stakeholders asked us, would we actually run a campaign? We rapidly decided to develop what we call the Time to Act campaign. This was in two parts. One, a data intelligence study to really see what was happening at the European level, and then also to use that to drive a campaign right across Europe. And what we found was really worrying. This is just some of the key messages in relation to 100 million cancer screening tests not performed in Europe. 1 million cancer patients who may be walking around with a cancer diagnosis that they don't know they have. Critically, impact on treatment and also on diagnosis, but also impact on cancer patients and citizens. So less likely to go to their GP, to attend screening appointments, to go to the hospital for treatment, and also the impact on healthcare workers. So 4 out of 10 feeling burnout, 3 out of 10 showing signs of clinical depression. These are really worrying data. And what they did was then informed our campaign, and our campaign really is aimed at 3 key stakeholders. Most importantly, cancer patients and citizens. Please don't delay. If you have warning signs or symptoms of cancer, please see your doctor. If you have a screening appointment, please keep that appointment, similarly for treatment. Cancer services are safe. For healthcare professionals, there are ways in which you can be supported right across the cancer continuum, and look at ways in which we can share best practice and work together right across Europe. And critically, and I'm not going to make any bones about this, in relation to policymakers, health system leaders, governments, we really need to put cancer back on top of the agenda. Every action that we take now in relation to the cancer backlog, in relation to what you've heard from the various speakers today, will help save lives. We launched it officially at the European level in the European Parliament with Stella Kyriakides on the 11th of May. As you can see, there have now been 11 launches, and today marks the 12th launch in countries throughout Europe. So it really has gained impetus right across Europe in relation to this campaign. You can all play your part. Support the national launches. Share the campaign materials that are available there on our website. Work with us. We really want to work with the community in Ireland and to look at the best ways we can move forward together. And then one of the things we said was, how do we capture all this data that's been accumulated right across Europe? So we developed a Time to Act data navigator. This really allows us to have an interactive map of Europe where you can visualize what's happening in relation to the different countries. Over 200 data sources present, looking at screening, diagnosis, treatment, patients and people at risk, and healthcare professionals. And this is very much a living tool. And we want people to submit data to the Time to Act data navigator. And again, you can link to it there on the website. And so really using data to drive both our COVID and cancer agenda is really important. And now show you a short video in relation to the data control.
COVID-19 has led to major consequences for cancer in Europe. The Time to Act data navigator highlights this impact on an interactive visualization hub. Hundreds of data sources have been analysed and displayed, making data accessible for an ever-growing list of European countries. Browse data by choosing your category of interest. The interactive map also allows you to monitor the impact of COVID-19 on cancer by region or by country. Help us track the evolving impact of COVID-19 on cancer by sharing new data with us. It's time to learn from these insights and build back better. It's time to act.
Many thanks for that, Mark. This really demonstrates, as we all know, that pandemics have no borders. And it's very important and demonstrates how important for us not only to work together in Ireland, but to work at a transnational level to address the consequences of COVID-19. So we're going to move forward to the panel discussion now, which will be moderated for us by Mark. Mark.
Thank you very much indeed, Richard. And what I'd like to do, first of all, is give each of the panelists an opportunity for 1 minute, really to make their pitch in relation to their particular thoughts in relation to COVID-19 and cancer. So it gives me great pleasure first to welcome Maria Fleming, who's the advocacy champion for the Irish Cancer Society. Maria.
Thank you very much, and I'm delighted to be here and to be a voice for patients. So my story starts the way a lot of people's story starts with finding a lump in the shower one morning. And thankfully, I had the foresight to, as soon as I stepped out of the shower, I made that call. I contacted my GP, and I am living proof of what everybody has been talking about, that early diagnosis delivers better outcomes for people. So my diagnosis was in the end of 2019, and my treatment plan was to be a lumpectomy followed by chemotherapy and radiotherapy. And this was in the end of 2019. I had my surgery, I began my chemotherapy, and I actually looked in a journal that I had from 2019. And in December 2019, I had written that I was feeling very isolated, that I was spending a lot of time at home alone, that I was missing time with friends and going out. Little did I know that within a few short months, the whole world would be joining me in my isolation. And when our Taoiseach stood up and spoke from Washington to announce the lockdown of the country for the pandemic, that was the day before I started radiotherapy in St. Luke's, where I would be attending 4 weeks of therapy, having to attend a hospital every day for 5 days a week during a pandemic. That is not what I had planned. I have a slide here that just shows, I tweeted on that day from the waiting room in St. Luke's, and I was very frightened. The response to that tweet, there was over 3,500 people liked the tweet, and normally my tweets would be liked by the usual 5 people that I know. So it obviously had a strong impact and resonance for other people. You'll see in that picture, I'm sitting in an empty waiting room. I'd already gone through half of my treatment, and I was used to bustling, busy areas of hospitals. And to wander down those corridors on my own, to sit in a waiting room on my own, was very disturbing and very frightening. And particularly at the early stages when there was so little that we knew about the situation, and it was an ever-evolving situation. Every few days when I would go to the hospital, the recommendations and conditions would change in relation to who was wearing masks or what areas of the hospital were open. So the fear that I felt at that time and that people are feeling now, what will allay that? Well, what everybody has said so far: clear communications, clarity of information. What cancer patients need now is to be told very clearly it's safe. You are in safe hands. The amazing frontline workers are there to hold you in their care, to hold that space for you and to mind you. I would also like to speak to another issue that other people have mentioned, and that's the loss in screening days that we had during the pandemic. As part of my treatment, sometimes I would be sent for a mammogram, and at the start it was packed rooms with concerned women all sitting in packed rooms going into their treatment, and then later on going down to the mammogram area in the hospital and being the only person there. And I would look at the empty chairs and think in every second chair should be a woman who would be getting the diagnosis that day, who isn't getting that diagnosis. So it's really important that we get screening back up and working at full capacity. It's really important that cancer patients are given clear messages from services, from government at every level, that it is safe for them to return. And I also would like to say that for survivors who have been through their treatment during the pandemic, there is a mental health issue now that we need to address to help people deal with concerns that they had. And I would call on the government also to support those initiatives, those support organisations. I've joined the Pluribel Paddlers, which is a dragon boat team made up entirely of women who are breast cancer survivors. And that gets me outdoors, exercising and socialising with other women that have been where I am. And I can't stress the importance of that camaraderie, and we need to provide that for everybody, and we need to support that financially. So thank you for the opportunity.
Thank you so much, Maria, and really your shared experience is so important, and the messages that you've highlighted there are really critical. Now it gives me great pleasure to pass over to my colleague and friend, Professor Louise Burke, who's the Dean of Pathology at the Royal College of Physicians in Ireland. Louise.
Thank you, and thank you all for the invitation to be with you here today on what is really, I think, a very momentous day for us all. Following on from a conversation that I had with Mark in July 2020, where I had seen his work, I had listened to his work on investigating the impact of COVID-19 pandemic on cancer-specific services. I broached to him and with him the possibility of looking at that within Ireland. And out of that, we convened a group with many of the speakers around the table here today to look at just that within the Irish context and see how were we doing in relation to other countries such as the UK and Northern Ireland. Having worked through the two reports, which were published in 2020 and 2021, and after seeing all of the challenges that we experienced, I just wanted to share two things in particular that really I would like to see come out of all of this, and what I think would really enhance our ability to really optimize our cancer service delivery going into the future. The first thing is the importance of comprehensive real-time cancer-specific data underpinning our cancer service delivery. This really cannot be understated. It is so important, and we saw this as we were trying to get the data together. We have identified in Ireland that there are many different data sources to work on, but the difficulty was the lack of integration, the lack of ability to be able to get this in a real-time way from all of the sources which we identified. So from the report and from the work I was doing, we really, and what I would be looking for is that we would critically look at all of these data sources. We would look at how we could enhance the integration of all of these existing resources, and also work at enhancing how these resources can actually give us real-time data to help people like Richard O'Leary with the National Cancer Control Programme in his efforts to try and deliver the best possible cancer services for the patients in this country. I would also call on complete implementation of the e-health strategy, whereby we would bring in the individual health identifier to help us to be able to monitor how patients are progressing through the systems, both public and private health systems, and that we would have integration of all of that data to be able to give to people that are managing our healthcare services. Also, the implementation of our national medical laboratory information system would also greatly assist in giving us that data based on what is happening within the pathology services around the country, the diagnoses that are being made, etc. The second point I just want to make, and I'll be very brief with this, is that the data that we were actually showing, it really showed to us how the system was gaining resilience as we learned how to cope with the COVID pandemic. We could see that the marked reductions in activity, very much similar to what Mark saw with the DataCan data, that we experienced very early on in the pandemic, was not being seen as we went through further lockdowns throughout 2020, and this was great. This was good for us to be able to see this. But what I would call on is that we would be able to maintain that. We would be able to augment that. We know we have backlogs. We know we're going to have increasing demands, and we need to be able to deal with them. And from the perspective, I guess, and you'll hear from my colleague, Professor O'Reilly, from the oncology aspect, from my perspective as a pathologist working with thoracic malignancies, I would like to know that I would have the backing of all of our service to be able to meet that demand, have the resources to meet that demand, have the professionals to meet that demand, and to be able to offer all of our patients the services that they require, including molecular pathology services, where we're in the era of personalized cancer, targeted therapy, and to be able to give that to everybody. And I'm happy to say that we have started working with Professor Richard O'Leary in that particular regard. So I would call on all services, the government, to be able to assist us, all health professionals, in being able to deliver that service. Again, thank you, Mark. Thank you, Richard. Thank you, everybody, for the invitation to be here. Thank you.
Thanks very much, Louise, for very clear and concise messages there and asks, if you like, of how we can work better using data intelligence going forward. And also, I'd like to personally thank you for your leadership in relation to the Faculty of Pathology-led data intelligence studies that really highlighted what the challenges are, particularly in Ireland. I'd now like to pass on to Professor Dr. Katrina McCarthy, who's consultant in public health medicine in the National Cancer Control Programme. Trina.
Thanks, Mark, and thanks to everyone for coming along today. And it's been really important, I think, to reflect on how we've needed to ensure prioritization of cancer service delivery during this time, and that this is something we need to do going forward as well. And also to think about just what a challenging environment it has been for patients and staff. What I'd like to mention really is, I suppose, some changes in service delivery that we've had to put in place during the pandemic. Some of them have been temporary, necessary measures, but others are actual, innovations that have improved services, I think, and are things that we want to put in place. And one example is, I think it was touching on what Maria was covering around, the need for ongoing patient support. And through the pandemic, and we were very conscious of how, it was difficult for everyone in the country, but if you were someone who'd gone through cancer treatment or a cancer diagnosis, and the fear and the worry. So one initiative put in place was the Together for Cancer Concern helpline and psycho-oncology service, which was a virtual service, but it did ensure that you had access then from any part of the country. And this was an initiative between the NCCP, the Irish Cancer Society, and Cancer Care West. And it's those kind of things, I think, which, maybe COVID gave us the push to put them in place, but there are things which we need to maintain. And in addition to that, focusing on psycho-oncology care for all patients, using the cancer support centres, having those networked into services and funded, and doing that through the cancer strategy. I absolutely agree with Maria's the way forward. Other improvements that were put in place that are close to my heart would be access to diagnostics for general practitioners. So there was improvement during the pandemic in terms of GPs being able to request diagnostic tests directly, rather than everybody having to go to an outpatient in a hospital department to get a test done. And that's something, again, which has been maintained, and the evidence is irrefutable in terms of improved access there, and quickening the time to diagnosis for patients. So there are absolutely things which need to be maintained. Just the one other point I wanted to mention, which the Commissioner touched on, was around modifiable cancer risks. And I think, we know from the WHO that 30 to 50% of cancers are modifiable, and that there are, lifestyle elements that we can all work on to help reduce our risk. And particularly when it's World Cancer Day, I think it's important that we reflect on that as well. And the pandemic has influenced us all. Some people will have taken up better habits, we'll say, and some of us will have, found that the weight's gone up, or, other things have been affected. So I think they're important things that we need to look at, how to support our whole population in leading healthy lifestyles, and what have we learned there. And with the Irish Cancer Prevention Network today, we're holding a public webinar at 1 p.m, which everyone is invited to, which will cover that, as well as looking at the signs and symptoms of cancer. So for information on that, or other information on early detection of cancer, I'd ask people to go to hse.ie/cancer prevention. Thanks.
Thanks very much, Trina, and thank you very much indeed for highlighting some of the adaptations we've made because of COVID, because I think that's really important to capture as well. And now it gives me great pleasure. It's great actually having this panel, because I selected the panel, so I know everybody on the panel, which is really nice. Seamus O'Reilly, consultant medical oncologist, Cork Mercy and the South Infirmary University Hospital, and also Vice Clinical Lead for Cancer Trials Ireland. Seamus.
Thanks very much, Mark. So the statistics presented today by your group are very sobering, but statistics are human beings with the tears wiped away. And I think that in response to the pandemic, we need to convert disruptive change into transformative care in healthcare. Our patients need it. We have 1 million people on the waiting list today, and pandemics magnify inequality. So the poorer on that list are going to be there longer than the rich on that list. We need to focus on 3 areas, I feel. First, flexible recruitment and retention, as exemplified by the Royal College of Surgeons in England New Deal for Surgery, and by the French government's accelerated citizenship programme for non-national healthcare workers. Our health service would have collapsed in the pandemic without the non-national healthcare workers. It's time that we fronted up and were respectful to them as a society, I feel. Secondly, we need to fast track health infrastructure in physical buildings, digital infrastructure and diagnostics, with the universal healthcare number that Professor Burke, my colleague, has discussed. I think we need a national task force on this to implement it, because burnout doesn't affect our healthcare workers. It is also prevalent at administrative staff in the government departments, who've also had a very stressful 2 years. We've done this before. Noel Brown did it after the Second World War, when our country was much poorer. And finally, we need to reach out and catch up strategies in our screening, as Maria Fleming has outlined. We have done this already with Cervix Check, and they are the exemplar in this field, where they've done a catch-up program, but also a catch-out program. The catch-out program is a reach out to the immigrant community using community leaders on social media to ensure equity of access to the new Irish with their programs. We can't afford to squander a once-in-a-century pandemic to get our healthcare system as a better functioning organisation. Thank you.
Thanks very much, Seamus. And again, some very good key ideas in terms of practical ideas of how we can move forward and really provide what I would almost say a reimagined cancer service for our patients. Now gives me great pleasure to introduce Rachel Morrow, who's the Director of Advocacy and External Affairs in the Irish Cancer Society. Rachel, great to see you again.
Thanks, Mark. On behalf of the Irish Cancer Society, I would like to thank the European Cancer Organisation for inviting us to contribute to the important discussion that's taking place today. As a national cancer charity, we've been there to support cancer patients directly over the course of the pandemic. And our nurses have taken over 15,000 phone calls and responded to a further 17,000 inquiries to our daffodil centres since March 2020. And that's given us a really clear picture of the human impact of some of the statistics that have been outlined today. The impact has been quite devastating and will continue to be borne by patients and their families for many years to come. And that'll be in the form of the delayed access to care, the psychological effects that have been described, and most alarmingly, reduced cancer survival as a result of an increase in the late stage cancers that Professor Murray mentioned. We know that the pandemic hasn't ended, and today on World Cancer Day, patients are still attending hospital appointments alone. They remain anxious about the time to treatment, and they still worry that the service that they need may not be there for them. We know as well that many cancer patients have spent the last 2 years in a state of heightened anxiety, and that was compounded by being unable to access the usual support from family and friends. And now, as wider society experiences a kind of euphoria with many restrictions ending, the opposite is actually the case for cancer patients who are very immunocompromised and have not had an adequate antibody response to the vaccine. So fearful of getting COVID, and there's no plan in place for them to access rapid PCR testing or COVID treatments, their world is actually becoming smaller as they isolate from friends and family once again, and they're reinforcing measures that they hope will keep them safe. So our concern is that, having arguably been the group most affected by the pandemic in terms of their risk of serious disease from COVID and the limitations on the availability and the access to their cancer care, some cancer patients now face a future that is just as uncertain as it was 2 years ago, and this needs urgent political attention. So as the world moves on, we must ensure that no one is left behind.
Thank you very much, Rachel, and very much highlighting what the impact has been and will continue to be on cancer patients. I'm now going to go into asking some questions from the chat, and I'm going to do this quite quickly because we are running a little bit late. But one question here in relation to lots of evidence showing potential impact in terms of later diagnosis, for example, but actions need resources. Have we started estimating how much will be required and how resources can be best directed? I might ask maybe Trina and Seamus just to answer that question. So maybe Trina first.
Yeah, I mean, I think, one of the biggest things is putting resilience into the system. So I think our investments in the National Cancer Strategy, we already knew a lot of the solutions to this, I think, and it's just pushing forward on getting those in place. We did see, I suppose, some improvements in getting through. We're just coming out of another wave, I suppose, of COVID. So it's also being kind of strategic around what time inroads can be made into waiting lists and that, because staff have been affected by this as well. So that's another challenge. So it's just important to remember it's not just funding and resilience. It's the whole population being affected by COVID has sort of tied our hands at times. But investing in a more resilient service as we go on is definitely the way to go.
Thanks very much. And Seamus, from your point of view?
Yeah, I mean, I think that quantification of where we should be versus where we need to be, I think really requires the task force that I talked about. The cyber attack showed that our information technology infrastructure was seriously vulnerable, and I think that will take some time to become resilient, and it may be time to reimagine the health service using Professor Burke's patient number and then integrating that into a system. But I think the 1 million people on the waiting list would tell us we're behind. I think quantifying what we need to do to address that is much more challenging. It's a bit like a Rubik's Cube where there are multiple components involved. And it's only when you take a bird's eye view of it that you'll be able to see what that is. It's very difficult when you're in the trenches to quantify it. And that's why I suggested the task force idea, because it would allow quantification followed by action. Because as you've emphasized in all of your presentations, data drives decision making. And when we don't have the data, it's very hard to drive decision making correctly. I think the one thing everybody in the panel could agree on is that we are behind. But everybody would have different opinions about how much we need to catch up and what should be prioritized as well. In healthcare, the urgent takes precedent over the important continuously. But the important maybe is building a resilient service for the future, because this is not the last pandemic we will experience. It's not the last cyber attack we will experience. 60% of organizations that have a cyber attack will have another one. Months after the national one, the Coombe Hospital had a cyber attack affecting it. So it's going to be a continuous cycle. This is our new reality. And we will exhaust our health force and our society if we don't make it fit for purpose now, and if we don't harness the impact of and the potential transformative change of our time now to do that, we'll have squandered an opportunity significantly.
Thanks very much, Seamus. Another question then in relation to remote consultations and how have they worked for cancer patients and for people who are at risk. Maybe Maria first and then Rachel, just to your thoughts on that. Is remote consultation the way to go? Or are there only some situations where it will work? Would welcome your opinions on that.
Yeah,
Maria first.
Thank you. I was lucky in that I was facilitated to have all my consultations and treatments in person, and just from a personal point of view, that my desire to have direct contact with my team outweighed my fears of leaving the house and going out into a healthcare situation. But I think it would be fantastic if there was a hybrid system and it was offered, because everybody's experience will be different in terms of people's comfort levels with traveling, their ability to travel. And one thing to say that the costs are still prohibitive for some patients, and the issue of car park fees in hospitals. I know this seems like a segue, but it's connected. If somebody has, can't afford the car park fees and is forced to go on public transport, they're more at risk attending their appointment than if they're able to not pay car park fees. But I think a hybrid system would be great if it was possible for people to not do face-to-face if they're not comfortable or if it's prohibitive for them. But the ideal would be that if you wanted to and were able to, that you could attend in person, because there's no comparison to that experience for patients.
Thanks very much, Maria. Rachel?
Yeah, I agree with exactly what Maria said there. I think that we've been carrying out research on this, kind of tracking it throughout the pandemic and people's satisfaction with the online engagement. Like Maria says, it really suits some people, and particularly, when they're very vulnerable, and the online consultation really works. But for others, it hasn't worked so well. And I think that there needs to be an option for people to return to in-person health when it's safe for them to do so. But I mean, we really appreciate the National Cancer Control Programme putting measures in place which did enable people and give people guidelines, so that activity could happen in that way.
No, thanks very much. I use the example of, now that we've started to meet people in person rather than through Zoom or Teams, sometimes I realize that people are actually completely different heights than I thought they were. But the other challenge is, how do you, for example, judge whether somebody has lost weight while you're talking to them on Zoom, which obviously can be an indicator of development of cancer. Apologies, by the way, for having to move around there. Amazingly, in Belfast, it's so sunny that actually the wall was bathed in sunshine, and I had to move to actually be able to be seen properly. So apologies if I distracted anybody by doing that. Final question that I have from the audience is, I'm going to direct it towards Louise, is, we've heard a lot about data, but how do you really use data to drive policy change?
Thanks, Mark. Well, I think you know me at this stage. I'm a big proponent of the importance of data, because if you don't have data, you don't know what's working, you don't know what's not working, and you don't know what you're going to fix. And I think that is it in a nutshell. I think one of the key things, as I said, that came out of our report is we have a lot of data sources, each giving us their own individual look on what's happening with our cancer services. And I think if there was one thing that I was to say to the government, the NCCP, the HSE, is what I really would like to see us doing going forward is, for all of the things that everybody is talking about here, could we really have a very high level steering group or look at all of those data sources? What are the barriers to getting the information from those sources? There's governance, GDPR, etc. How do we get over that? How do we bring those data sources together? How do we integrate them? How do we enhance the data that maybe we think we need and what we should be getting? How do we put that in place? And finally, I think the key thing, and one of the things that I think we all saw when we were bringing this data together during the pandemic, is the problem with trying to get it in a real-time way. If data is going to be good for looking at what's happening in a system, you need to be able to get it in a timely manner. And unfortunately, a lot of the data systems that are out there, they were set up for different reasons. And therefore, that timeliness isn't necessarily in there at the moment. So that needs to be encompassed within it. So if I was to ask for my big wish, like Santa Claus, what would I like at this particular point? I would like a high-level steering group to really have a look at this, go through all the barriers, go through how we can bring all of these data sources together, and how can we really have a data-driven, cancer-specific intelligence in a real-time way to underpin everything that everybody is talking about here today.
Thank you very much, Louise, and would heartily agree with you on that score. Now I'm going to hand over to Richard, who has some final remarks, and then I'll come back to me for some very final remarks. So Richard.
Just to say, I just want to thank the European Cancer Organization for their Time to Act campaign and for organising today's events, including the backroom team who were on with us this morning and helping us technologically, despite my own inabilities in that area. I'd also like to thank all of today's speakers and all the panel members, and they've given us really a lot of significant insights into the issues facing us who are involved in helping to provide the cancer services in the light of the pandemic. I suppose we shouldn't forget, and to tell everyone not to forget, no, like the COVID bacachur darling like la hailsha. So and that'll be, I know, Mark's new tagline. And I just finally, just to say, I look forward to collaborating with all the partners who've been on this on the Zoom call today to work together to address the important issues facing us. Thanks a lot, Mark.
Thanks, Richard, and I very much echo your comments. And again, I think it's been a really super discussion. Thanks to all the speakers. This has been recorded, so we'll be able to capture this, and people will be able to go back to look at it who weren't able to make the live session. It just comes to me to say goodbye from sunny Belfast. I don't say that very often, and we're just going to show a multi-language Time to Act compilation to end with. So thank you very much to everybody, and thank you to the audience, and thank you for their questions. We tried to answer as many of them as we could. Thank you.
Thank you very much.
Don't let COVID-19 stop you
from tackling cancer.
Älä anna koronan estää syöpäseulontaa.
Il Covid non deve fermare la lotta contro il cancro.
Não deixe que a Covid-19 o impeça de enfrentar o cancro.
ne engedje, hogy a Covid megakadályozza a rák elleni küzdelemben.
Не позволявайте на COVID-19 да възпрепятства борбата с рак.
La Covid-19 ne doit pas être un frein aux soins contre le cancer.
Laat COVID-19 u er niet van weerhouden kanker aan te pakken.
Laikas veikti. Neleiskime COVID-19 stabdyti mūsų kovos su vėžiu.
Nu lăsați COVID-19 să vă împiedice în combaterea cancerului.
Μην αφήσεις την COVID-19 να σε σταματήσει από την αντιμετώπιση του καρκίνου.
Ne dopustite da vas COVID-19 spriječi u borbi protiv raka.
Covid-19 darf der Behandlung von Krebs nicht im Wege stehen.
Laat COVID-19 u er niet van weerhouden kanker aan te pakken.
Time to act.
It's time to act.
It is time to act.
Don't let COVID-19 stop you from tackling cancer.
Nie możemy pozwolić na to, żeby COVID-19 zatrzymał walkę z rakiem.
No dejes que el COVID te impida hacer frente al cáncer.
We can all make it a success and call time on cancer. It's time to act. For all of us, to act together. To find out how, go to timetoactcancer.com. Thank you.
Remember, it's time to act. Don't let COVID stop you from tackling cancer.
Nálig de COVID bacha chuir leat doling lech le hailse.